Hey, Glenn here from Mehab, the world's leading physical therapy alternative, where we educate and empower you to take control of your recovery. In this video, we're going to show you how to determine if you have a rotator cuff tear or not. As always, this information is meant for education and demonstration purposes only. With that out of the way, let's get into it. The rotator cuff is comprised of four muscles: the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. They help with the stabilization and movement of your arm at the shoulder. Rotator cuff tears can result in significant loss of function. That is, of course, if the tear is relevant. And by relevant, I mean contributing to your pain and/or loss of function. You see, rotator cuff tears can be a normal adaptation. For example, one study looked at Major League Baseball pitchers without any symptoms. An MRI showed that over 90% of them had at least one pathology, including full rotator cuff tears and labral tears. A study in 2013 found rotator cuff tears in 22% of the general population, but only 35% of those people had any pain. It is also important to note that it still didn't mean that their pain was actually coming from a rotator cuff tear. People over 50 with a rotator cuff tear on an MRI without any pain are likely to be considered a normal part of aging. Part of the problem with testing for a rotator cuff tears is that you can't isolate a particular muscle during testing. All muscles of the rotator cuff are active with any of the special tests. Two of the most common tests used to assess a tear of a commonly torn muscle called the supraspinatus are the empty and full can. However, they produce high levels of muscle activity in all the shoulder muscles. This means that all it can really tell you is that you have pain when you do these tests, and that's pretty much it. So how do you know if your pain is coming from your rotator cuff? Well, there are three tests that can give you a pretty good indication. The first is a pain on resisted external rotation. Stand with your arm at your side and your elbow bent at 90 degrees. Place the back of your wrist against the door frame or grab it with your other hand. Try and rotate your forearm away from you, but resist the motion. A positive test would be pain or weakness compared to the other side. The next test is the painful arc sign. With your arm at your side and your thumb pointing out, raise your arm over your head. Pain that occurs around 45 degrees to 120 degrees is considered a positive test. The last test is the Hawkins-Kennedy test. You can either do this test yourself or have someone help you. To perform this test yourself, stand with your arm across your stomach. Place your other arm over the top with your elbow in the back of your hand and also grasp your elbow. Lift your involved arm up so that it's at shoulder level. Press down with the elbow of your top arm and rotate the involved arm with your hand. A positive test is reproduction of your symptoms. Please keep in mind that this only indicates that your pain is likely coming from your rotator cuff and does not mean the pain is coming specifically from a rotator cuff tear. So how do you know if the pain is coming from an actual tear? Physical therapists are taught and use special tests that are supposed to provide an indication of what particular rotator cuff muscle is injured. Unfortunately, not all of them are that great. The three most common tests are the drop arm test, the hornblower's test, and the lift-off test. The drop arm test is where your arm is lifted out to the side about 90 degrees and then support is removed. A positive is considered when a person is unable to stop the arm from dropping. This test is not very sensitive or specific, meaning it can't rule in a tear or rule out a tear. So it is really a pretty pointless test in helping determine if you have a rotator cuff tear. The next test is the hornblower's test. In this test, take your hands and bring them up to your mouth as if you're going to blow on a horn. Then raise your elbows. A positive test would be the inability to raise or rotate your elbow. This test can rule in a tear, meaning that if you are unable to raise your elbow, you are likely to have a rotator cuff tear. It is important to know that being able to do this test cannot rule out a tear, meaning you can still do this and you could still have a rotator cuff tear. The last test is the lift-off test. To do this test, place your hand on your lower back. If you can't reach that high, you can place it slightly lower. From here, try and lift your hand off and away from your back. Unlike the other tests, this test is great for determining if you do or do not have a rotator cuff tear. If you are able to lift your arm off your back, it is unlikely that you have a rotator cuff tear. If you are not able to lift your hand off your back, it is highly likely that you do have a rotator cuff tear. It's important to remember that lots of things can cause shoulder pain and weakness, and they're not all just rotator cuff tears. Keep in mind that finding a tear on an MRI does not mean that it is definitively the cause of your pain or your problem. There are lots of people with significant rotator cuff tears without any pain. So what do you do now? Who is best suited to have a repair? To find out, subscribe so you catch our next video where we'll share who and when you should consider getting a rotator cuff repair. Thanks for watching, and before you go, please hit that like button, be sure to share us with your friends, and we'll catch you on the next one.